So acne is essentially a physiological condition. So it's a rite of passage for most teenagers. Uh, and it's usually self-resolving, but it can cause quite a lot of physical destruction to the skin when it's at its most active, and of course can affect patients in terms of self-esteem and confidence. There are other types of acne which are, I suppose, classified as late persistent acne, those people who never outgrew their acne in the way they should have done. And then there are patients who experience late onset acne, usually women rather than men. Family history, as for so many conditions, is very important. It's not entirely predictable, but usually when a patient has severe acne, there's one or other parent who's had similar symptoms as a teenager. So the treatment strategies are essentially about controlling the severity of the condition, waiting for people to outgrow it, particularly when they're teenagers. And we use anti-inflammatory medication, which can be either topical, which you put on your skin, or tablets that you take orally. Now, for those patients who have scarring acne, we usually give a vitamin A product known as Roaccutane in the UK or Accutane in other parts of the world as a supervised course of treatment, which can be very effective in clearing acne. In terms of can it respond naturally, yes, there are naturally in the sense that it's a physiological condition for many people and it improves by itself. There aren't too many alternative non-pharmacological products that are effective for acne, but there are many cosmetics and over-the-counter products that use ingredients that we have used in dermatology, such as salicylic acid, benzoyl peroxide, which can help with milder cases of acne. Patients with acne are not at increased risk of skin cancer. However, there are patients who become aware that sun exposure clears their skin, and if they're not careful with their sun protection, in theory, that increases the risk of skin cancer. Additionally, years ago, when we didn't have some of the effective treatments we have available now, we used to give phototherapy or UV light treatments, and these do increase the risk of skin cancer. Okay, acne and rosacea are actually two completely different conditions which share in common a similarity on the skin. So patients can have little red or purple bumps and they can have pustules. The essential difference is that rosacea tends to occur in later life and it is non-scarring. Acne tends to occur earlier in life and can be scarring. The time course of response to common antibiotic treatments can also be different in that patients with rosacea tend to respond quicker within 4 weeks or so, as opposed to acne patients who usually take a little longer. If you have acne, it is permissible to use makeup, but essentially we dermatologists recommend oil-free or non-comedogenic products. We also recommend avoidance of exfoliative cleansing regimes like facial scrubs and exfoliators. The makeup, even if it is oil-free, can be pore blocking for some individuals with a very acne-prone skin. And it's worth remembering that sunscreen should also be oil-free during the summer months. If your acne is not responding to simple over-the-counter treatments, do see your family doctor in the first instance or come and see a dermatologist, and we can formulate a tailored program of treatment to control and ideally clear your skin permanently.